Cardiovascular disease, the most prevalent cause of death in the developed world. It's a disease that globally claims around 17 million lives each year, the majority suffering heart attacks and strokes. This represents about 1/3 of global deaths. In developed countries like Australia, the proportion is even higher, where approximately 40% of all deaths are caused by cardiovascular disease, significantly higher than mortality from all forms of cancer combined. It's a massive problem and one that is costing the public health system around $5 billion of total recurrent health expenditure every year. And with Australia's ageing population, this percentage is growing at an alarming rate. For a 40-year-old Australian, the risk of having coronary heart disease at some time in their future life is 1 in 2 for men and 1 in 3 for women. It's a problem where treatment is both complex and expensive, and until now, solutions have been hard to find. Intelliheart diagnostic testing is the new approach to the assessment and management of cardiovascular disease. At present, most cardiovascular tests are performed to obtain results after a patient attends with overt cardiovascular disease. These tests tell the physician how the heart reacts to increased workload. However, stiffened arteries cause the major forms of heart disease. Traditional tests are complex and expensive. Their ability is limited in the detection of structural and functional abnormalities of the arteries before the end stages of advanced cardiovascular disease. Intelliheart offers a simple, non-invasive method of detecting blood vessel disease long before signs or symptoms of vascular disease first appear. It permits the measure of premature stiffening of the arteries. Intelliheart's technology is a system of primary care, non-invasive cardiovascular diagnostics that may be used in hospitals, general practice, and even the home and office. The Intelliheart system upskills general practitioners to manage cardiovascular disease by enabling them to diagnose, treat, and monitor the effects of treatment in a way which has not yet been possible in an unsupported general practice. The system uses a proprietary computer algorithm, and various measurements are taken using both established and highly innovative technology. These measurements include blood pressure, ECG, heart rate variability, and an assessment of arterial stiffness. As well as these tests, various blood tests are performed. The Intelliheart system generates an easy-to-understand report, together with copies of test results and explanatory notes, which can be given to the patient. The report can also include a treatment plan. The Intelliheart system allows for a very early diagnosis of the likelihood of an individual developing cardiovascular disease in later years. A shift in medical practice, from reacting to a health problem to preventing it. The system can be administered by general practitioners, in fact by their nursing staff or a trained technician, in their surgeries. The Intelliheart tests provide a comprehensive, non-invasive assessment of cardiovascular status and can be used for diagnostic screening as well as for ongoing monitoring of existing conditions. Because of the breadth and ease of administration, Intelliheart's tests are applicable to the whole circulatory system. For example, kidney failure, stroke, heart, leg artery, etc. IM Medical is listed on the Australian Stock Exchange and retains ownership of a number of medical imaging technologies, including technology for medical image processing and capturing and for transmitting medical images securely over the internet. Intelliheart technology looks set to revolutionize the way cardiovascular disease is detected and treated in its early stages, greatly increasing the life expectancy of millions, while significantly reducing the costs to governments, insurance companies, commercial groups, and individuals.